We're glad to have you with us this weekend. I'm Dr. Derek Da Silva, and this is 12 to Health. By the way, nearly 150,000 people die in this country every year from stroke, making it the third leading cause of death. Stroke is also the leading cause of long-term disability. Joining us to talk about what you need to know is Dr. Clarke, an emergency room physician at Raritan Medical Center in Perth Amboy. We're also joined by Susan Summers of Chatham, who suffered a stroke last year at the age of 39 with no known risk factors. Thank you very much to both of you for joining us.
Thank you.
So let's start off with you, Dr. Clarke. What is a stroke?
Well, basically, a stroke is a brain injury. It can happen from different ways, and if your brain doesn't get enough oxygen to it, which is carried by the blood, the brain cells start to die off, and depending on the part of your brain that's affected, that's when you get your symptoms of having the stroke.
And Susan, 39, and you had a stroke? I mean, what happened?
I awoke in the morning, ready to start my day as a mother with my 2 children, unaware that anything was happening to me. We did not make it to my son's music class. My daughter didn't make it to preschool. My friends became suspicious something was wrong. Came to my house, found me in bed. My daughter said, "Mommy's very sick." I was taken to a local area hospital. Later in the day, I was told I had suffered an ischemic stroke. That was, quite frankly, the craziest thing I had ever heard. People
Wow.
my age don't suffer strokes. Contrary to most people's belief, this only affects the elderly.
Wow. Well, I mean, and let's get to that from there. What are the signs and symptoms of somebody that's having a stroke?
Well, there are a few different signs and symptoms that we tell people to look for.
And we've got them on the screen right now.
If someone has numbness or weakness to the face or to a certain part of the body, or especially one side of the body is affected, that's something to be aware of. Also, if someone develops confusion, difficulty speaking, difficulty seeing things. Some people may lose vision in one eye, they may lose vision in both eyes, they may lose part of their vision. These are all signs that people have to look for. If you have severe headache or confusion that happens instantly, also signs to watch for. People may complain of dizziness, they may complain of being unable to walk, pick up something. So these are all signs.
Now, what did you have, Susan, as part of this whole thing? What did you have of what we just mentioned?
I was unaware of anything that was happening to me.
Wow. And how old did you say your children were?
5 and 2.
So it was your friends that said, hey, you know, she's not around, what's going on? Let's get in touch with her, and that's how this happened. Wow, that's just absolutely frightening. And I know the important thing here, Dr. Clarke, is being an ER physician, is you want to see these people early, right? The earlier the better.
Correct. The earlier you get into us, the more chances we have of helping you. Right now, we do have medications that we can give. As we said, well, just to backtrack a little bit to talk about the type of strokes that you have. You can have an ischemic stroke in which you have a blood clot. The blood stops your blood circulation to the brain. Or you can have a hemorrhagic where you have bleeding to the brain.
Right.
We need to know as early as possible with both. If you have bleeding, you need to have surgery to try to correct that. If you do have a clot, we have medication that if we see you within 3 hours, we can actually give medication basically to break up the clot, to return blood
And
flow.
Susan said she had no risk factors. Let's talk about the risk factors. What are some of those risk factors? And we have 2 categories of this. Risk factors that should we say, can change, some that we can change, and some that we can't change. Let's talk about the things that we can't change first.
Right, things that you can't change, your age. You know, once we hit that magical age of 40, that we
okay.
That's a risk factor, as well as your family history, if someone's had them, your gender, males are more prevalent, your race.
Guys always get ripped off here, don't they? Guys always get ripped off. Anyway.
Your race, African Americans have a 2-time higher risk factor than Caucasians.
Okay.
And also if you've had prior strokes or TIAs.
What about some of the things that we really can't, that we can change? Obviously the simple ones, smoking, those things.
Right, smoking, high blood pressure, diabetes, heart disease. Those are things that you can help correct.
And then we've got a couple more. Sickle cell disease, high cholesterol, those are all important too?
Your poor diet and also physical inability or being obese.
Right. You had none of these, Susan. You had none of these.
I exercised, I didn't smoke.
That is just absolutely, absolutely. And then, you know, what about the whole idea of stroke and you know, the Power to End Stroke. Tell us about that real quick. We're
Right,
almost
that's
out of
a
time.
program that the American Heart and American Stroke Association came up with in 2006, that by 2010 they want to try to reduce stroke mortality by 25% by letting people know what's out there and what you can do, and to get treatment early so we can try to save your life.
Important thing is, if you know something's going on, get to the ER, call 911, and that's just the way to go. Thank you so much to both of you for being here. Pleasure to have you with us. And folks, once again, after the break, how some local children